Thank you, Madam Chair. It seems like the more information that we get, the more questions that are created, and it really seems like there's a pattern of delay here. The chairwoman already asked you why it took so long for the FDA to inspect the Sturgis plant. Why was there a 3-month delay between the Abbott recall and the closure February 17th and the decision to waive FDA's strict formula labeling in importation requirements in May 22 despite the national shortages?
So I think if I heard your question, there are many questions embedded in there, so let's take one at a time. You mentioned labeling. We put in place an enforcement discretion policy to allow safe, nutritious formula to come into this country to help make sure that parents could find product on store shelves during this period of this national shortage. We did have certain labeling requirements, and they are primarily for things like safety. For example, a baby that has a cow's milk allergy needs to know if a formula is based on cow's milk or soy. So there are certain label issues that are critically important for safety, like allergen information. Also, how to prepare a formula. Some formulas need to be diluted to different amounts than others. Over-diluting risks having infants not get enough nutrition. Under-diluting means the product won't flow through a bottle and babies won't get the necessary nutrition.
I understand why we would have labeling, but why is there a delay from February 17th to 3 months later when that labeling actually took place? Why was there such a delay in the labeling?
The formula recall started on February 17th. We then went through a series of steps to try to address shortages regarding infant formula. And given the market concentration in this country, that is not an easy step. There were a number of things we did. For example, we received product from across our borders from domestic manufacturers that have plants in other countries. We expedited the entry of those coming into the country. We worked with the infant formula manufacturers that were not at the Abbott plant, not the Sturgis plant, to increase their production. We did a number of different steps to get that into place. We wanted to bring in safe product from abroad. We had to put out a guidance document, tell others, tell us if you want to bring product into this country, this is what we need to see from you. We need to know those products meet our nutritional criteria. We need to make sure those products have been tested for safety the same way we expect our domestic products to be tested. We got applications, and we started bringing those products into this country. In total, we issued, I think it was 20 letters, 36 different products, including specialty and medical products that were allowed to come into this country under enforcement discretion. And now we have doubled the number of infant formula manufacturers bringing product into this country, and that's through FDA's actions. So we jumped into action. We used what levers we had to try to address the formula shortage, but there are some levers we couldn't address, the market concentration. But as you've heard, we have taken steps to try to address those. More things are needed to prevent this into the future, and we are very willing to work with Congress and in an all-of-government response to make sure that we don't have this problem again in the future.
A week before the formula recall on February 10th, FDA leadership activated the Coordinated Outbreak Response and Evaluation Network, CORE. To your knowledge, were senior White House officials notified at that point?
I know that White House officials were notified on February 16th. I don't know if they were notified on February 10th, but I am aware that we did send a communication to the Supply Chain Task Force, which would include the White House on February 16th, which was the day before the recall. And just to be clear, the science was evolving on February 10th. We did not have the information in place that we had Cronobacter. That information was not available. We were doing the inspections. We had collected samples. The information about Cronobacter and the sequences actually came in on February 13th. So at that point, we had more information that this plant was contaminated on February 13th. That led to the ask of Abbott to voluntarily recall. We notified the White House and others on February 16th prior to the recall occurring.
If the White House was aware, why did it take 3 months for them to step in and help address the shortage of baby formula?
I can't speak to what the White House, what their actions were, but what I can speak to is that we were working in an all-of-government way throughout this process, including with regard to the enforcement discretion products. We worked very closely with Health and Human Services on Operation Fly Formula to bring those products to the U.S. market as quickly as possible to help rectify the shortages that parents in this country were experiencing.
And lastly, yes or no, did you talk to the White House about the possibility of a formula shortage? If so, when?
I am aware that we talked to them through a written memo on February 16th. Whether there were previous conversations with the White House, I can't say, but I can say that that information was shared to the White House before the recall occurred.